Hello everyone, I am Nishant Singh, BMS first year from Shree Ayurvedic Medical College, presenting you artificial respiration. Artificial respiration is required whenever there is an arrest of breathing without cardiac failure. Causes of arrest of breathing: accidents, drowning, gas poisoning, electric shocks, anesthesia. Stoppage of oxygen supply for 5 minutes causes irreversible changes in tissues of brain, particularly tissues of cerebral cortex. So artificial respiration must be started quickly without any delay before the development of cardiac failure. Now we will study about methods of artificial respiration. There are two methods of artificial respiration: manual methods and mechanical methods. Manual methods can be applied quickly without waiting for availability of any mechanical aids. There are two types of manual methods: mouth-to-mouth method and Holger-Nilsson method. Mouth-to-mouth method. In this method, the subject to be put in supine position provided with clean air. The cloth around his neck and chest region must be loosened. By keeping the thumb on the subject mouth, the lower jaw is pulled downward. The nostrils of the subject are closed with the thumb and index finger of other hand. Now takes a deep breath and exhale into subject's mouth forcefully. We should keep in mind that volume of exhale air must be twice the normal tidal volume. Repeat this procedure 10 to 15 times until normal respiration is restored. Now Holger-Nilsson method. In this method, subject is placed in prone position with head turned to one side. Hands are placed under the cheeks with flexion at elbow joint and abduction of the arms at the shoulder. Now, by placing the palm of our hand over the back of the subject and by bending forward with straight arms and apply pressure on the back of the subject. Due to this pressure on the back of the subject compresses his chest and expel air from the lungs. This procedure causes expansion of thoracic cage and flow of air into the lungs. Apply this procedure at the rate of 12 times per minute till the normal respiration is restored. Now we will move towards the mechanical methods. It has become necessary when the subject needs artificial respiration for long times. It is of two types: drinker's method and ventilator method. Drinker's method. The machine used in this method is called iron lung chamber or tank respirator. The equipment has an airtight chamber made of iron and steel. Subject is placed inside the chamber while keeping his head outside. By means of sub-pumps, the pressure inside the chamber is made positive or negative alternatively. During the negative pressure, the subject thoracic cage expands and inspiration occurs, and during positive change, the expiration occurs. By using tank respirator, the patient can survive for longer time, even up to a period of 1 year. Now we will study about the last method of artificial respiration, which is ventilation method. In this method, a rubber tube is introduced into the trachea of the patient through the mouth. By using a pump, air or oxygen is pumped into the lungs with pressure. When air is pumped, inflation of lungs causes inspiration, and when it is stopped, expiration occurs. And the cycle is repeated. The apparatus is used in ventilation is called ventilator. It is of two types: volume ventilator and pressure ventilator. This method of ventilation is mostly used to treat acute respiratory failures. Thank you for watching the video.